Welcome back to All Day on Fox 9 on this Tuesday afternoon. Last week, the board of Hennepin HealthCare appointed Dr. John Cumming as the new CEO of Hennepin HealthCare. And this comes during a turbulent time for the healthcare organization and for HCMC, whose operating losses could reach $50 million this year. So joining us now is Dr. John Cumming to talk about what he expects with this new role. Thank you for joining us.
Well, thank you for having me. Good afternoon.
Yeah, you were interim CEO of this 2019 to 2020. What made you raise your hand to say, I want to come back and help out now?
Well, I can tell you that I first stepped foot on the campus of Hennepin HealthCare in 1991 and then completed 29 years with the organization in various roles, including doing my training here, residency, and then following that up as a staff trauma surgeon, and eventually getting into more progressive leadership roles. And I care dearly about Hennepin HealthCare and the people that work here, but also the incredible resource that it is for so many people, even across the state and region. And so it is a vital, vital resource. And when I saw an opportunity to help preserve that, I raised my hand. And so here I am. And I'm very, very happy to be involved.
Let's talk about the recent history here and what lays ahead as well. So it was last August. I was at this Hennepin County Board meeting where they voted to take over oversight of Hennepin HealthCare. There were concerns even then of a closure, even potentially by the end of last year. Now we kind of hear those same things again. A budget shortfall last year that has only grown this year. Operating losses, 7 of the 8 previous years. What is the very real dire situation that you face right now?
Well, I'll tell you, this was kind of something that slowly developed over time. And again, not a long period of time, but in the past couple of years, there's been increasing pressures on healthcare organizations really across the country with healthcare costs that are rising faster than inflation, faster than, the gasoline you pay for, the eggs, et cetera. It is outstripping inflation. It's right around 7 to 8% currently annually, the healthcare costs, the cost of providing care. Meanwhile, reimbursements to the healthcare systems and providers is continuing to get tighter and tighter and tighter. And it is producing incredible pressures on healthcare organizations and providers across our country. The reason it's creating newsworthy pressures on Hennepin HealthCare is that we bear the burden of providing a large amount of services to those that might not necessarily be able to afford services elsewhere. We are truly the safety net hospital for, again, not only Hennepin County, the state, but in some cases even the region. And so we are feeling those pressures magnified.
What fears do you have about, trying to overcome this threat of potentially not being able to stay solvent?
Yeah, I don't necessarily wouldn't phrase it as fears. I am optimistic, quite frankly, after watching some of the legislative sessions, that there appears to be unanimity amongst legislatures, both Democrat, Republican, supporting the role that Hennepin HealthCare plays, and that a durable solution is hopefully being discussed. And so again, I'm more optimistic than having fears at this point. But again, we have to wait and see what our elected officials are able to craft as hopefully a durable solution for the organization and the community it serves.
Now, there is a bill proposed to raise what was a tax that helped pay for the construction of Target Field, to raise that tax from 0.15% to 1% to generate upwards of $300 million a year that would help Hennepin HealthCare as well as North Memorial. It would also pay for some improvements at Target Field, but a lot of that is focused on Hennepin HealthCare. Is that what you see as really the crucial thing that needs to happen?
That is the option that's being proposed by a number of our elected officials, including support from the Hennepin County Commissioners. Again, my focus right now is on the organization. I need to make sure that we are doing our job as well on this end with regard to making sure that operations are efficient, that we have the right personnel in the right positions to support all of our critical services. And again, what is happening at the legislature is, I think, giving me some comfort that they are working on a solution. What that solution ultimately is, I don't know. My focus is here on our patients and the staff that work here.
And on that, certainly, morale has got to be an issue that you have to address there. There have been recent cuts because of these financial considerations and shortfalls. What do you do now? I know you just assumed the role late last week, but what is your first order of business in terms of trying to address some of the concerns among staff that might affect the whole environment there?
Well, I think one very, very important thing is that I have a long history here. I'm known by many, many of the staff here, and I'm a familiar face. And what I need to focus on is them by being visible, communicating clearly, and communicating my optimism that I just communicated with you, that I believe there's a path forward for the organization. I'm thankful for the incredible work that our staff provides every day. And that's the best thing I can do for them to help support them, but do it in a very visible and reassuring way.
Yeah, certainly helps to have somebody that's well recognized with a long history coming in there. If Hennepin, the hypothetical, obviously there is going to be a huge effort to make sure that Hennepin County Medical Center does not have to shut its doors. I can't imagine that would, it's hard to even imagine that would happen, that it would come to that point. But if it were to come to that point, the ramifications for the region would be what?
Incredibly impactful. But again, I'm very optimistic that we won't have to see that as a reality. I understand that a lot of people are thinking about, well, what if that happens? I understand, but it will put such a thing. And again, I don't necessarily want to talk about that, but really, it would have an incredible impact not only for the residents of our community and state, but it would also affect the other healthcare systems, I think, in a significant way. And I would leave it at that. Okay,
understandable. I mean, you don't want to wade too deep into the hypotheticals there. Your focus here, as you said, is on optimism, on doing everything possible to address these severe financial problems and look for the solutions. Well, thank you for joining us. Thank you for raising your hand to take on a pretty monumental task here. And best of luck to you in that endeavor.
Thank Thank you very much for having me.
All right, there you go. John Cumming, Dr. John Cumming, taking over as CEO at Hennepin HealthCare in what is a very difficult time there, navigating some financial troubles there to try to keep the doors open. Again, a safety net hospital that serves so many, and many of them from outside the county here. All right.